My name is Dr. Christopher Menke. I'm a board-certified forefoot and rear foot podiatric surgeon. Unfortunately, when it comes to bunions, it's a structural problem, and it's where the bones are out of alignment. And so there are a variety of things on the market and in magazines that you can purchase to try to push the bunion over. But at the end of the day, it is a structural issue, and 90% of it is from genetics. I think 10% probably is from wearing shoes and other environmental factors, but at the end of the day, a majority of it is based off of genetics. I usually tell patients that you go through a surgery once your foot is bothering you to the point that it's affecting your daily activities. Long-term patients typically do very well with the surgery and are pleased afterwards. It's all an outpatient procedure. What you'll do is you'll get an IV started in your hand, and they'll give you some twilight medication, so you're going to fall asleep. While you're sleeping, we'll put some medicine in your foot, and so throughout the procedure you're going to be very comfortable. In addition to just shaving down the bump that's on your foot, we'll actually make a cut in the bone. This will allow me to shift the bone over a little bit to give you greater correction. At that point, what we'll do is we'll use a screw or a pin to hold the bone together, and it typically takes bone about 6 weeks to heal. And for that reason, I usually recommend patients about 6 weeks of decreased activities after the surgery. Now, this doesn't mean that you're laid up in bed for 6 weeks, but just that you're not walking around or, say, going to the mall for 10 hours a day. At the 2-week mark is when I allow you to start getting your foot wet. We take all the dressings down, and you can start to progress back to your shoe. It's at this time where I have you start doing range of motion exercises to your toe, and we would use a device afterwards such as a Dynasplint to help facilitate that range of motion. The nice thing about the Dynasplint is the patient can take this home with them. They can do this as much as possible on their own on a regular basis. And a lot of times this is enough to where it gets patients back to their comfortable range of motion. Probably one of the biggest things that helps you to recover the fastest is one, decrease your activities, and secondly is using a post-operative range of motion machine such as a Dynasplint.